just to introduce our multimodal molecular imaging Italian node, and I am the responsible of one of the centers that contribute to this node. The node is distributed in 4 cities around Italy: Torino, Milano, Napoli, and Pisa, with 8 facilities involved in the node itself. The activities that are offered by the Italian node are an open access to state-of-the-art in vivo imaging technologies, including high-field MRI, PET, SPECT, optical imaging, ultrasound, and photoacoustic imaging for both preclinical and clinical research. In particular, my center contributes for the preclinical research. Obviously, these technologies are supported by well-trained staff with long-lasting experience and technical skill for the execution of the service, a large repository of imaging agents and tracer, and also several models, as well as cellular animal and cellular models, and a list of additional services, like, for example, data analysis, image analysis, ex vivo and in vivo validation, and imaging modalities, probes, and tracer preparation. In particular, in going to my center is in the San Raffaele Hospital of Milan. The San Raffaele Hospital of Milan is the larger and most important biomedical research center in Italy. And within San Raffaele Hospital, we have the experimental imaging center that includes a lot of clinical research groups, core facilities, basic research group, and R&D groups in the field of imaging. And in particular, here we have the preclinical imaging facility, that is the components that we have in San Raffaele that contributes to the activities of the Italian multimodality imaging nodes. You can see that in the center we have all the scales of resolution for preclinical research, to going from basic to the imaging in the patient. In particular, in the preclinical imaging research, we have 7 Tesla small bore magnet that now was integrated also with cryoprobe technologies, an high resolution digital ultrasound system, and optical imaging with also the possibility to co-localize the signal with a CT scan, an entire platform for the imaging of mouse eye, including both OCT and angiography, a small animal imaging guided precision irradiator for precision image guided radiotherapy, and we are close and connected with a micropet, and we include also photoacoustic imaging. Obviously, in this facility exists from more than 10 years, and we have developed the modality of imaging and analysis for hundreds of different animal models, both in the field of cardiovascular disease, of oncological disease, infective disease, and neuro pathologies. Here are just a few examples in the field of hepatocellular carcinoma or liver metastases, pancreatic cancer, prostate adenocarcinoma, but also we have studied the heart with different sequence for characterization, the muscle, the brain, and so on. So we have experience to characterize really a lot of different preclinical models in the different field of disease and of research. Also with a lot of experience in cell labeling and tracking. I think that this is, yes, the last slide. So just to invite anyone needs to have access to these technologies, with also the support of experienced operator, is invited to contact us. And now I give the word to Lorè for a presentation on a specific project in the field of infectious disease, which is developed in our facility. Thank you very much.
So yeah, as introduced by Professor Esposito, we perform a study in order to define the role of magnetic resonance imaging to study murine model, in particular focusing our attention on chronic lung infection in a mouse model. I'm a biotechnologist and I work at the Emerging Bacterial Pathogen Unit, and this project was conducted in collaboration with the preclinical imaging facility headed by Professor Esposito. And so just going a little bit in detail, we work on opportunistic pathogen, and this project was focused on non-tubercular mycobacteria that are a family of pathogens that are emerging in US and Europe. There are several different pathogens, and the most frequent one recognized in the hospital settings is the Mycobacterium abscessus. In particular, Mycobacterium abscessus can infect patients with different disease, including genetic disease such as cystic fibrosis or occupational or environmental disease such as chronic obstructive pulmonary disease or other similar disease. I mean, I don't go in detail with incidence or other detail, but this is the biological interest that our lab is working on. And in particular, this bacteria, it has been described that have three different subspecies, in particular the Mycobacterium abscessus subspecies massiliense, the subspecies abscessus, and the subspecies bolleti. So in this project, what we, I mean, we evaluated that the prevalence of this bacteria is emerging, so was a good candidate to study and develop a new mouse model. The mouse model reproducing this long-term chronic infection are necessary in order to better develop new antibiotic or antimicrobial or anti-inflammatory treatment. And one of the challenges is also to apply magnetic resonance imaging in order to follow longitudinal progress of the infection, because these animals have to stay for long term in the animal facility. And this could help us also to discriminate better how the progression of the infection will occur in this animal in terms of resolution of the infection, or, for example, in terms of extensive damage in the lung area. So for this reason, we decide to in particular, to develop the murine model using C57 Black 6 mice, and to try to explore the use of magnetic resonance imaging in order to monitor the degree of the infection severity, and to study the progression of the lung disease during the time. So just to move this, so okay. So the first step was to set up the mouse model. We work with opportunistic pathogen, and we set different mouse model. And in this project, we focus on abscessus, but we work also with gram-negative and gram-positive pathogen. And in opportunistic pathogen do not persist in mouse lungs, so we use a sort of trick to persist this pathogen within the airways, exploiting agar beads. So we embedded this bacteria in agar beads, and this is briefly the method that we use. And we were able to, we usually infect the mice and look, once we set the model at the early time point, how is the bacterial burden after 7 days. And also for Mycobacterium abscessus, we were able to observe that these bacteria included into the agar beads were able to persist and to induce a morphological change or a damage in the overall lung, and in particular in the lobes where the infection were established. So we moved to our Mycobacterium abscessus subspecies, and we set an experiment to to, merge both data, the biological data related to the immunopathology that we usually collect in our standard approaches, and to follow the animal through the magnetic resonance imaging. So this is the experimental design that we performed, and we infect the animal and we follow the animal at different time point. And we sacrificed, the last time point was after 70 days post-infection. And as for our classical readouts, we were able to follow the bacterial burden at each time point. And as you can see here, we were able to induce a stable chronic lung infection. In this graph on the right, you can see the bacterial burden over the time. And as you can see in the lung, you can observe that this bacteria was able to persist up to 16 days. And going ahead, we observe also that in terms of histological feature and inflammatory profile, these bacteria were able to induce an extensive damage in the parenchyma and the inflammatory process in the airways. So confirming what we expected on this model based on the persistence of this bacteria. And this was confirmed also with the two other subspecies. So these are the data that we found out with Mycobacterium abscessus subspecies. And this was confirmed also with Mycobacterium abscessus bolleti, where the bacterial load, as you can see here on the graph on the top right, is a little bit lower, but as you can see, as you can appreciate by the histology, we also achieved also in this case damage at the parenchymal levels, suggesting that the immunopathological process occur over the time in our model. We confirm a similar trend also for the third one, Mycobacterium abscessus, the Massiliense one. And then, so the model was set up, and we were sure that in our model we can reproduce in some way immunopathological aspect similar to the human disease. And so we wanted to follow these mice also by magnetic resonance imaging in order to understand whether this technique can be applied to follow longitudinal this animal, and as you can appreciate here, and thanks to the collaboration with the Professor Esposito group, we were able to identify inflammatory foci by magnetic resonance imaging, in particular starting from 7 days and 35 days post-infection. And we observe similar data also for the other two types of bacteria, so the subspecies bolleti and the subspecies Massiliense. Of course, these were data that we wanted to extend, and for our last publication, we increased the days to follow this animal longitudinally, and in particular, we arrive up to 90 days post-infection. And as you can see here, comparing control and infected animal, we were able to identify the infected loci in the animal that develop infection by abscessus, in particular are 45 days and at 90 days post-challenge. So overall, just to briefly conclude, we can affirm that we were able to exploit the magnetic resonance imaging to evaluate the pulmonary lesion by Mycobacterium abscessus in our mouse model. In particular, this technique clarify and easily identify the lesion over the time, although some limitation could happen with with the use of the agar bits at the early time point. But overall, we were able to identify infected animals and discriminate those that resolved the infection and those that were still inflamed and infected. And this I mean, we wanted to develop this approach and this technique because we wanted to follow our animal, and in particular to follow the treatment of our animal model using antibiotics or anti-inflammatory drugs. And this will help us to define better potential outcome of our treatment in our model in order to define new drugs against this pathogen. Of course, there are some limitations that we wanted to highlight, that in some way the cost of the technology, but at the same time, the reduction of the animal can limit this cost, and those in terms of ethics could be much better. And of course, for us that work with infection disease field, the infected animal needs a logistic that allow them to be moved and to be allocated in space together with other pathologies, such as, for example, cancer research or other type of pathology that must be separate from infected animals. And overall, of course, we are trying to apply this technique for, as I told you, for treatment. And the final goal is also to apply this technique with the other respiratory infection model that we have, because we work also with, for example, Staphylococcus aureus or Klebsiella pneumoniae or Haemophilus influenza. So we want to apply this approach also for to follow the infection of other bugs and with the final aim to identify new antimicrobial or anti-inflammatory drug in these settings. So before to conclude, I would like to thank the emerging bacterial pathogen unit, in particular the Prof. Cirillo Daniela, that is the head of the unit, all the colleagues that collaborated with us, and thanks again to the preclinical imaging facility for this excellent collaboration and fruitful work that we perform together. And thank you for your attention.